Welcome back. And today I'm going to talk about a disease called Empyema, and then a couple herbs, gualo and zibai in Chinese medicine, and how they go together and what the relation is to Empyema. So, first of all, Empyema, it's probably not a condition that most of you are familiar with. Empyema is It's a complication of when you have fluid built up around the lungs, and that fluid develops into a infection, and it is more of a bacterial infection. It gets thicker and it doesn't drain. Empyemas are not common. A lot of times we have patients who have just regular pleural effusions, or what we call pleural effusions, which is fluid in the pleural space. So typically, you can think of your lungs as having kind of two linings. There's the lining which just surrounds the lung, but then there's a lining that goes around the lung in the chest wall cavity, and those two linings can have fluid buildup in between there. Most of the time when you get pleural effusions or fluid in the lungs, it's built up because of either just too much fluid overload, a lot of times in heart failure, cirrhosis, those kinds of diseases, you can get fluid buildup in the lungs. But empyema, it can be associated with those things when you have fluid that's been sitting there and then it gets infected. It can happen because of a pneumonia that then goes off and infects the adjacent pleural space. And then it can just happen spontaneously. Sometimes people just develop infections in that space and you build up fluid there. And that fluid is a little bit more, compared to a pleural fluid, it's thicker, it's a little bit more like pus. Um, and a lot of times it has to be drained surgically. So you might use a chest tube. A lot of times doctors will have to put a chest tube in there to drain it out. But a lot of times it even needs actual surgery where they go in and have to manually clean it up. And oftentimes using a procedure called a VATS, or video assisted thoracoscopy. And so it's definitely a complicated disease in Western medicine to treat. Now, I wanted to talk a little bit about gualo and zibai in Chinese medicine and how they treat um, fluid that has built up in the lungs. Now, in the Chinese medical literature, there's no empyema. That's just not a word that's ever used, and for good reason. They didn't have the testing, they didn't have x-rays and CAT scans, they weren't able to go in and do surgeries back then like they do now, but they used different descriptors to describe the process of fluid building up in the lungs and having infection. And a lot of the things they used to describe it were symptoms. So in cases where patients had difficulty breathing, fluid sounds in the lung, pain radiating to the back. Those were some of the descriptors that were used to describe the indications for gualo and zibai. Now, this herbal combination was actually used pretty early on in Chinese medicine. It was initially formulated by a physician named Zhang Zongjing. He was one of the great physicians in Chinese medical history, and in the third century, he wrote a very famous book, the Shanghan Lun, which describes this combination. Actually, it was in another book, essentially the Golden Cabinet, which was a compendium and a companion to the Shanghan. And in that book, he describes this formula, and he describes a number of formulas which use this combination of gualo and zibai. So the question is, what makes this combination, this pairing of herbs, so unique and beneficial for diseases like effusions and potentially empyema as well? And the answer is that gualo is an herb. It's a sweet and cool herb, and it has a special property of breaking up what we describe as phlegm in the lungs. Now, phlegm in the lungs is, in Chinese medicine, it's like having fluid, but it's thicker it's stickier, and it's harder to just dry out or get rid of. A lot of times when you have phlegm in the lungs, you can't just dry it out. When you try to dry phlegm, it becomes thicker, more concentrated, harder to get rid of. So phlegm actually has to be treated in a different way. So you can use herbs like gualo, which are known to transform the phlegm or break up the phlegm. They break up the clumping. And in this way, it can treat phlegm that has built up in the lungs. Now, along with that is an herb that's combined called zibai. This is the Chinese garlic. And this is an herb that is used to help move the qi, especially the qi in the lungs. And it also has a capacity to move the qi downward. So this pair works in two ways. Number one, gualo helps to break up the phlegm that has built up, and then zibai helps to direct that broken up phlegm downward and expel it from the chest, expel it from the lungs, and get it out of the body. Now, interestingly, in these kind of cases, when we talk a little bit more from the Chinese medicine side, um, this is considered a case where you have cold phlegm pathogen built up in the lungs. Now, usually the lungs are a space which is governed by a little bit more of the yang energy. The yang energy is the energy that is in the upper part of the body. It is a commanding type of energy. And your lung and your heart are two organs that are have a very strong movement function. That the lungs are regulating the chi of the body and the clear air, and then the heart is regulating a lot of the blood movement. And so um, yang is abundant in the chest. Now, when the yang of the chest becomes weak, then the yin of the body can rise and infiltrate that space. And when it does, it can cause problems. And so, this is a formula that's helping to restore the yang space of the lungs and of the upper body and of the chest, and it helps to get rid of the yin substance, the phlegm, the fluid that's built up in there, and it helps to improve and unblock the yang so that it can continue and restore its function of regulating the chest. And so this is a combination that is used for fluid and phlegm in the lungs, and it's been used for hundreds and actually over close to 2 millennia in Chinese medicine. So it's a good consideration for if you've had problems with empyema, or you want an adjunctive treatment to help along with whatever treatment you might be doing in Western medicine. Is something to consider. And it's something that we're familiar with at Houston Acupuncture. So if you have more questions, reach out to us. You can find us at www.houstonacupuncture.com, and we will see you next time.